So good afternoon and welcome to all of you to such an exciting day. And I want to welcome you all. We have quite a wonderful, I want to say, agenda full of exciting things to share, but also not forgetting the event itself, why we are where we are and why we are doing what we are doing today. So whilst we have all those things coming up, so let's go through our very first item on the agenda, and I want to start with the land acknowledgement so that at least we can begin our event in a way that allows us to gain some gravitas on the work that we're about to do. So with that in mind, I would want to start with that to say Keria Community Health Center acknowledges the ancestral land on which we live and on which we, our agents Keria, provide services, and is a traditional and treaty territory of the Mississaugas of Scugog First Nations. And we acknowledge that also the people who have lived on and care for this land, the Mississaugas of Otherville First Nation, Kevlek First Nation, Hawatha First Nation, Scugog Island First Nation, the Chippewas of Basoli First Nation, the Georgina Island First Nation, the Rama First Nation, and the nations who have gathered on this territory pre-treaty. This territory is and has been home to many indigenous peoples before and is now covered by the Williams Treaties of 1923. And as a community health center, we also recognize the traumatic impacts of the healthcare system, the historical and present, and on the health and well-being of the First Nations communities. And as settlers and visitors, we offer this acknowledgement as our very first step towards the path to reconciliation and recognizing that we are all bound by the treaties that govern these lands and have the responsibilities to thrive towards that equitable relationship. And with that, I want to thank you all for coming and participating. As I mentioned, that we have a wonderful agenda packed with all of the good news and good stories to share. If I was going to have an exam today, I'll be asking to say, you know, what day is it today? But I won't do that because I know we are right towards the holidays and almost right towards the end of Thursday. I know most of you and some of you will not be working either tomorrow and or Monday. So I want to take an opportunity to thank you for that. So may I ask those that are not speaking to mute your mics, please? I'm hearing some background. Okay, great. Eka, I'm just hoping I'm sharing here. Can you see my screens?
Yep, we can see them.
You can see them? Wonderful. So as we move on to opening the event, today I want to come in as a chair for this committee, which is the Black Health Committee, which is the committee of the Alliance, founded back in 2019. The 2019 through the, I want to say, rigorous work of the Alliance and its members to recognize some of the disparities that were happening within the communities and the communities we serve across the province. Specifically, most of you who have been here for longer than I have, you understand the work that the Alliance has always done and continued to do and what becomes the pillar and the anchor of the mandate that the Alliance is here to serve. So identifying the work of the Black Health Strategy was one such pivotal step that drove most of us to be here to make sure that we actually give birth to what we are going to be sharing today. So without further ado, I want to also to make sure that I can share that this work, as most of you recall, in 2019 was also after the backdrop of most of the conversation that you remember from the George Floyd issues, but to talk about how do we make sure that we address anti-Black racism. What does that look like to make sure that at least a collaboration approach to address some of the issues that were there in the environment is going to look like. So that gave birth to all the members that I'm going to be announcing here as part of this committee, who came together, supported by the Alliance, to start to forge the work forward. So as we move on, let me just give this quick shout out to most of these folks that have done tremendous heavy lifting. So on my list, with no particular order, I want to give shout out to Angela, who you know is the ED for Parkdale Queen West, Cheryl Prescott, the ED for Black Creek Community Health Center, Florence, who is also ED for Center Francophone in Toronto, Kedon Diaz from LAMP, Liben Gebremikael, who is also the ED for Taibu, Lorian, who is also the ED for Women's College, Palos from Regent Park, Safia from Rexdale Community Health Center, Nala from Hamilton Urban Core Health Center. There are other members that are not on this list that you will not see, but because of the wonderful work they have done before, they moved into other opportunities within their life. I just want to recognize them so that when you hear of them and see them out there, give them a quick hug and a handshake. So one of them is Simone Otungo, who is now with the ministry, as well as Suzanne Obiera, who is also the Director for Inclusion with Public Health. I also want to shout out to Sana Dube. Sana used to be in the same role here, the Alliance, in the capacity where Daniel Townsend is. She's now with UHN as the Manager for Community and Population Health there on the Social Medicine Department. So I want to make sure that those individuals, don't go unrecognized for this work. Everything I'm going to be sharing today on this slide roadmap, it's a reflection of the work of all these folks and many others who are actually supporting in the background, whose names for the shortage of time I wouldn't go through, but I want to know that they are big pillars to that. And when we look forward to this work, I want you to understand, why do we need the strategy? And why do we need to get it right in this moment in time? The Alliance members play a pivotal role, as you know, in terms of addressing health inequities, but also the changes that happen to the system. So with this work in scope, where a couple of things that, or even three, that we will be actually focusing on, is to think about what are some of the inequities that we are talking about? What does those disparities look like? And where do we start? And you hear those conversations as you read the strategy, and what we have done in terms of what we will also do to make sure that the future of addressing some of the elements of anti-Black racism continues to be something that we never keep an eye off, is going to be crucial. So as we move along on the strategy, a couple of things that are crucial for you to know is the focus on the strategy. Where exactly is this strategy going? You will understand that from my earlier comments, the Alliance identifies some of this work as part of the pivotal work that happens within the room of the work that we do. So the strategy focuses on how do we make sure that we develop this strategy internally here now to make sure that you all, as member centers, you have the responsibility as Alliance members to push this work forward. You are the engines, you are the drivers for this work. And as an HSPs, you also know that you have the voices of the community right at the core of what you do. The work regarding the advocacy, the creation and the building of the policies to address these inequities, it's part of the fabric and the DNA of what you do. We definitely know part of the education that will be imparted out of this work is going to be a work that you will not find in any way, campus, but in addition to what you do, the vehicles and supports and the resources to make sure that happens is going to be one of the call to actions which we have today. How do we also make sure that work continues to be sustainable as we build the communities? Remember, it's not setting it as if people will come to it, but how do we make sure that the communities are engaged in that path towards building sustainability for communities that see the work as part of their deliberation. So I will not spend too much time speaking about that. So I will take off my PowerPoint here in creating some space to bring in some of our speakers at the end. When you hear more about some of the conversations we are covering, I would want to invite you to bring some questions and asking as many as you can to understand what are some of the things that you will be responsible for. We'll get to that question and answer. So with that in mind, I want to bring back to the next speaker. Daniel, is that Sarah that I'm bringing now?
Yes, yes, Sarah. So if you could please share the master deck, and we just go from there. So over to you, Sarah.
Great. Thank you so much for the introduction, Francis, to this incredible work. Anti-racism is a public health crisis, a crisis that requires urgent action. The Alliance is a learning organization, and as such, we may not have always gotten it right. However, we remain fervently committed to health equity and addressing anti-Black racism and its impact on the health and well-being of Black communities across Ontario. The strategy being presented today reflects our commitment to learn and act on what we have learned to realize the meaningful progress in advancing Black health. The Alliance stands together with the Black Health Committee. They have worked tirelessly to help move and continuously orient us toward a more racially just and healthier world for Black people. The reality of the impact of anti-Black racism is not just in health disparities faced by Black people in Ontario and Canada. The legacy of slavery and discrimination persists in countless social and structural determinants of health. To understand how this manifests today, one need only examine the disparities in healthcare, income precarity, food insecurity, and educational opportunities that have long harmed health and prematurely ended lives in marginalized communities. We see the legacy of these inequities in the COVID-19 pandemic. Black communities continue to be disproportionately affected by this pandemic, and all the while it continues to lay the inequities bare for all of us to see. Against this backdrop, we all have a responsibility to acknowledge and work to address these inequities. For the Alliance, this commitment is reflected in our foundational Health Equity Charter and this strategy. These documents reflect our values as an organization and as a sector of community-led and community-based primary healthcare providers, which informs our positions and roles within the broader health system. As the Alliance's CEO, I will continue to do my part to ensure that our organization lives these values. By doing so, we will be a stronger agent of anti-racist social transformation and advance the health and well-being of all Black people accessing our health system. For years, Black activists, including clients, staff from across our member centers, and Black Health Committee members called for significant structural changes in our health system's fabric to better meet the needs of Black people. This strategy reflects our need to achieve true equity in healthcare and in health conditions. It reflects our firm commitment to health equity. The uniqueness of this strategy is that it is community-driven and builds on our partnership with Alliance members, which is central to our mission and mandate. We will continue to do all that we can do to reduce health inequities and fully realize this strategy's goals. We must get this right. I call on you to do what you can so that we can collectively achieve what this strategy sets out. We are well placed to do so. This strategy reflects our reality, and the steps that we can take to make it a success are well within our reach. To conclude, this strategy is a turning point for us all, and I applied the hard work, shared insight, and determination of those who helped us get here. I especially thank the Black Health Committee for its stewardship and for raising the Alliance's level of ambition and commitment to Black communities. I also thank Daniel Townsend for shepherding this work. His commitment, passion, and leadership has been instrumental. We have covered a great distance with this strategy, but there remains a great deal left to do. And it is the responsibility of each of us to play a part in achieving the goals and targets that it sets out. You will hear more from the Alliance on the next steps in implementing this strategy in the coming weeks. I hope you will continue to join us on this very important journey. Thank you.
Thank you very much, Sarah. And we echo all those comments that you have made, and definitely the work could not happen without the heavy lifting of Daniel Townsend back there. We continue to have that pride and thankful for your hard work, Daniel. Thank you very much from myself and the committee. I know I'm the biggest demander of your time, day in, day out. I think sometimes Sarah will be like, Francis, do you want to take this guy with you? But you do wonderful. Thank you very much for that. So next is Liben, our chair of the board and for the Alliance, and also a member of the Black Health Committee. Inviting you to the podium, sir.
Thank you very much. I can see that my computer is playing up a little bit. I hope maybe I should. It's having some Zoom fatigue, and I think it's sensing the early start of the weekend also. So I may have to maybe. Is it okay so far? It's a brief remark I'm bringing in.
Yeah.
So
you're good.
Okay.
You're good.
So before, if something happens to my connection, I just want to shout out a very important person personally in my life and my career, but also I think for the Alliance and for this committee, who would be, who's happy seeing, looking down on us, but would have been also significantly happy to have achieved this milestone. And it's my dear friend, elder and colleague, Denise Brooks, who have been pushing this even before, at least I know, I came to the sector, both as a member center, but also on the board of the Alliance, as the energizing member of the Black Health Committee before it was named the Black Health Committee, but the group of Black Health leaders who used to meet. And I really want to kind of mark this day and to acknowledge and recognize the role that she has played in shaping us to get there. So yes, Michelle, I'm also a little bit emotional, but I'm happily emotional today. So I want to acknowledge my good friend Denise. It's a great day. It's a great day because we have worked, as has been acknowledged, all members of the Black Health Committee has worked tirelessly, including Daniel, to get us here. A lot of conversations, a lot of thinking, a lot of creativity. And this is, so it is a great day to acknowledge that we have something that will help us to continue this very important work. But more than a great day, I think it's an important day as I see it, because now the Black Health Committee is putting a challenge out there to our member centers to take this as something important in their own circles, in their own centers, in their own communities, in their own client, engagement, community engagement, planning, to kind of embed this strategy. It cannot no longer be a side strategy that is going to exist somewhere and we're going to refer to it. As Denise would say, if it's not part of a policy, the likelihood of it becoming a reality is zero. So we need to now incorporate this in all the work that we do. And so it is an important day that we are also committing to these important issues of anti-Black racism as member centers. At Taibu, we have a pathway that we have begun to really think about and explore, starting with acknowledgement. If we don't acknowledge, number one, that anti-Black racism is a systemic issue within our communities, and two, that is an important agenda to take on, I don't think we will start to really address this. And then following that, we need to create an accountability process. We need to advocate around the issues where Black communities and Black voices are not represented. And then ultimately, we need to create the space for our communities to occupy that space. So this ally relationship, community engagement, and working with the Black Health Committee closely to move these agendas forward. There are key areas in this strategy that we'll see whether it's policy, whether it's advocacy, whether it's capacity building, education awareness. We all have to take responsibility. And as the chair of the board, and on behalf of my colleagues on the board, we have fully endorsed with great energy and excitement this strategy as the board of the Alliance. And we also call upon all board members of the member states to endorse this, but more importantly, besides and above the endorsement, to start doing the work together as a community, because that's what our mandate has been. That's what the Alliance is about. And so this is the kind of excitement I hold, the importance I bring to you, and also thanking my colleagues on the Black Health Committee and Daniel for getting us up to here. It is now the responsibility of all of us to move it to the next level. Thank you very much.
Thank you, Liben, for those wonderful comments, and definitely the reminders to keep us, look back in the rearview mirror on where this work started. We hope it's a constant reminder, but also an energizer to how we continue to take that as a fuel on the journey and the path that we are taking towards this work. Next on the agenda, I want to bring Daniel Townsend, who you have heard from the beginning, has been and continues to be the force and the hardest worker in the background. And yes, we come here and celebrate the work and the sweat that he contributes day in, day out. And some nights and evenings, we are exchanging emails, talking about edits and tweaks. And sometimes that work, goes under the table unseen. But I want to make sure that this table takes the opportunity today in listening and hearing the presentation that is sharing about this strategy, and also where we go from here in terms of why this strategy is here and what it seeks to do for all of us, as we heard from the previous speakers. So Daniel, the floor is yours. Thank you.
Thank you so much, Francis. Hello, good afternoon to everyone. So I'm Daniel Townsend, and I came to this work as a consultant, but now I'm the lead for Black Health, the Alliance, and I'm very pleased to share this strategy with you. It is the work, it's a combination of about 18 months of hard work by the committee and difficult discussions at a time when there is increased attention to the impact of anti-Black racism on Black health. And of course, this has caused us to be focused, but also it's given us a sense of purpose as we develop this strategy and develop something that's specific to our sector. The uniqueness of the strategy, as you will see soon, is that it is really targeted for the Alliance, for Alliance members, which are community health centers, nurse practitioner-led clinics, and the role that we play in the health system, the unique role that we have. So this strategy, I hope you will see yourself in it and see your organization and see works that you can pick up. At the end of it, today is just a launch. We will be coming back to you with follow-up actions. We have a robust implementation plan ahead, so you will be hearing from us in short order. Next slide, please. So just a little bit about the Black Health Committee, and I just really want to shout out to the Black Health Committee for their bold vision. The committee is made up of such powerhouses, and the Alliance is a stronger organization because of it. These people are not just skilled at what they do, but also in some ways, in many ways, the moral holders of the work that we're trying to do here. And in that sense, working with this committee has always brought, it's not just a technical document, so to speak. It is a document that is oriented towards emancipation of people who look like myself, Canadians who've been here for a long time and continue to face structural barriers such as anti-Black racism, which blights or or overall achievement and full potential of our best selves. The committee itself has a mandate and a vision, and that is really to advance this strategy. That was the first thing. This strategy, it's, you know, as Sarah has said, is we're a learning organization at the Alliance. So there will be iterations from this as this work continues. Inequalities and inequities very quickly reproduce and reflect and you know, become new things, and we will always need to stay on top of it. So this strategy itself is time bound. But going back to a bit more what the committee seeks to do, it also seeks to increase access to appropriate health care for Black communities, and to support the implementation of evidence-based interventions which addresses squarely anti-Black racism as a driver of ill health, and also to engage policymakers and government officials and reorient them towards, you know, dealing to develop policies that would really, you know, make impact on our lives and the lives of Black communities. Next slide, please. So why a Black strategy? For all the reasons you know, even what you don't see here. It is timely, relevant, and it's also strategic at this point. There are still huge gaps that more and more we cannot pay, we just simply can't, you know, turn a blind eye to the disparities that are faced by in health outcomes that are faced by Black communities. It's right here in our face every day. So, you know, there's a sense of urgency why we need to act right now in this moment. And then also there's this partnership, you know, working in the health system and with a voice of the community, the voice of community, what's one element, but also the voices of Black voices. We're still creating space for ourselves. We've been here for a while. We've either, you know, you're used to seeing Black faces, but to center Blackness within health system within policy making is still something that there are many uncharted waters and territories that we have not yet gotten to. Indeed, this is the first Black health strategy for our sector. So the time is now. It is quite timely. But then there's an urgency that came up recently, not so much because of you know, what happened with George Floyd. I think George Floyd, for many of us, exposed many things that we knew. COVID itself just brought to bear pre-pandemic realities. So this is why we need a strategy. That we need to have something to hold ourselves accountable. We need to set out a roadmap that will enable us to measure progress and to continue and to mobilize different parts of our health system and towards you know, delivering better care and addressing gaps in the delivery of care, or really meaningfully addressing health inequities and anti-Black racism, particularly as it and its manifestations on Black communities. Next slide, please. So the rationale is really everything that I've said, but also, you know, we wanted to accelerate an investment case. And I say this because the case for Black health is still, I mean, the system is incredibly mobilized at this point and oriented towards making something about, doing something about this. Like I said, there are things that may perhaps COVID, it's just perhaps the time that we live in that we cannot put a blind eye to anymore. These things need funding. And it's important that you have a strategy that is evidence-based, that we've done the work to ensure that it reflects the needs of our communities, and we have voices that we consult with, that will really lead us towards long-term reform structures and systems, and that will also have greater economic and health, economic health and social equity. and having different collections, meeting certain targets, such as the collection of race-based data. Ultimately, the Black Health Committee of the Alliance is there to really direct the Alliance as an actor, all across the province, and orient what we're able to do towards the health and well-being of Black Ontarians, and also to help our communities to maintain good health. Next slide, please. So the objectives of the strategy. The objective of the strategy is really pretty simple. This is the first strategy. So there's an element that we need to coalesce. So we need to get everybody on board. Even within our own Alliance family, we need to get other people on board. I imagine some of us might understand it, what needs to happen, may not be able to see the urgency of this moment. So we have a fair bit of coalescing to do. We have to, there's a bit of having coalesced and knowing what done some coalescing, knowing what the need is, unmet needs. We do need to advocate for greater investments in our health system, and particularly within the Alliance, for the parts of the system that we operate in, to have more culturally safe and responsive care for Black Ontarians. And then there's also to promote the attainment of good health and well-being, and to address not just anti-Black racism, but all its manifestations, and also the other adjacent social determinants of health. So those are the three big objectives for this strategy for the next 4 years. I hope this, in saying this, we in the committee, I remember lots of discussions was to, where to start kind of thing. The need's always great, so we had to make real choices here. But I hope when you see this, these are things that it reflects the urgency of this moment, and it seems it is relevant and timely. And I do believe so, and the committee does believe so, and we're pleased to present this as objectives for you today. Next slide, please. So we have, from those three objectives, there are three big result areas. This strategy is not, we have to start somewhere. And we tried our best to ensure that we have enough coverage, that we can build a good foundation to continue a foundation that takes into account where we are now and all the work that has been done to get us here, but also to then lay the groundwork for further building and future work and future iterations of this of a Black health strategy. So the result areas are pretty simple. One is to improve policy, have improved policy and advocacy on Black health issues. And enhance public education to achieve, enhance public education to advance Black health. So greater understanding, building up an understanding of what those issues are among our members. And then also to ensure sustainability and to build partnerships, understanding that a partnership model is very important to our sector, to expand beyond just health. Beyond just health, anti-Black racism, while is a main structured determinant of health, also impacts many other things that are also very important to health outcomes. So these are the result areas of the strategy, and then the strategies underpinning these are principles, which I'll get into in the next slide. Next slide, please. So the principles they're called anchoring principles. in some ways, we're talking about we are talking about Black people, and we talk about Black people in a specific kind of ways. And one of those things is to center what Blackness means. That in itself can be quite a political task. They're not everyone that believe in centering Blackness. In some circles or schools of thought, the idea of centering identity is still something that you will find lots of resistance to, but that's not what we're about. We understand that the health system was not designed with us in mind. So with that, from that perspective, it's important that you center the person who will benefit this. And one of that is through a principle of Afrocentricity. And here I want to give a shout out to Liben actually and the work that they do at Taibu. In their Afrocentric model of care, because this is an early sort of help to inform this principle. And what that really means is that, you're looking at Afrocentric, communities-driven, holistic approach to action in Black health that is centered in health equity and addressing the structural determinants of health. Afrocentricity itself can be expanded to really focus on Black communities at the center of our response. It does not mean, and often people would think when you start centering one group, you're making trade-offs, but it means that you have in your frame among all the groups that we serve, Afrocentricity, so that we're not missing Blackness, and we are understanding the uniqueness of the Black experience in this country, in our health system, and help to orient or reorient the services and programs and policies that we come up with and implement and deliver towards meeting holistic needs. So that's very important. That's the first principle of the strategy. Next slide, please. So the other principle is to now, we're locating it in this moment, is to better inform the response to COVID-19. I mean, COVID-19 is still here, it's continuing, we're high talks of a sixth wave. Sometimes we were like, where is the end game in this? Perhaps who knows, hopefully, we're learning to live with it. But as we learn to live with it, when I think of this, I think about why it's important to focus on a pandemic like COVID right now, because it is not the first pandemic that Black communities have actually had to deal with. I can think in many recent times, how the HIV/AIDS pandemic, what it did to Black communities. And in that sense, it is important that we are able to, at this stage, intervene in the COVID response and help in whether it's post or mid or whatever it is, health system planning and processes, and bring to bear, the issues that Black communities face, and hold the system accountable to meeting our needs, that we are continued meeting our unique needs as a group that remains disproportionately affected by this pandemic. A big part of that is to, again, develop people-centered approaches and models of care that considers the disproportionate impact that COVID has had on Black communities. And also, because I'm talking to members or our own people, what it's having on us in terms of our sector. When this was developed, it was really thinking. I mean, one of the results is sustainability, and that really was a bit more inward focusing in terms of staff and resources, the staff and the people that we have to deliver care and services. But then also, now we have to think about having, where we are now, a bit more focus on the toll that this is taking on our Black staff in particular, as they continue to meet the needs of delivering care and services during this time. Next slide. So the next slide is, again, to address the social determinants of health. And that is really, looking at the upstream and downstream determinants of health equities, see how they interact, the contexts in which the manifestations of these determinants and the confluence of them on issues such as housing, education, income, and other issues, and how that affect health outcome, and also how those things are exacerbated by anti-Black racism. This is not new information. Everybody knows this. But I think what we're trying to say here is, some of that, I remember when you think about the social determinants, race, race is sometimes mentioned, and it's not, it's completely controversial whether it should be. But we want to think of Black health, not just, like we want to better infuse, when you think about Black people and the social determinants, and look at the, Blackness in that, and look at the uniqueness of how these issues actually bear down on our communities, how it intersects with gender and social inequities, and result in, continues to create barriers, new barriers. And that's very important. That we try to start addressing those things, because if it's anything we know about inequalities and whatever determinant is, that these things are not static. They actually they reproduce, they reinvent. Inequalities, these are socially driven things, and as such they're dynamic, and we also have to stay dynamic. And one of the reasons that we think some of we often miss the boat on this is because we're not really looking at race and the ways in which race plays an important factor on other adjacent issues, or related to maintaining good health. So this strategy really seeks to also center that as an anchoring principle. Next slide, please. Now, what would we do with the strategy that doesn't call for the adoption of race-based data? It's woefully inadequate. It's a shame that we don't have better data collection systems that can give us the full picture of what's happening to our communities. We do a pretty good job here. We try to do a pretty good job here at the Alliance, but there's still so much more that needs to be done. So with what we are also calling for, and this is something that is in top of mind for the committee when we're thinking about our implementation, is that we look at how we can better facilitate the uptake of specifically the collection of race-based data and its uptake in program planning and service delivery. So this is also a very important anchoring principle for this strategy. Okay, so the next slide. Now I think the slides goes into the result areas a bit deeper. So I only have a couple more slides, and I must let you know, we will be launching a brand new page after this with a dedicated resource page where you can see the strategy. I think we've sent the strategy out already, but you can then go a bit more and to see, this is only a snapshot of what's in it. Going back to the result areas, the first one, which is improve policy and advocacy, what we would like to do here over the next 4 years of this policy is to mobilize Alliance members to advocate or to do something about, to do more to address the root causes of racial inequities and how that affects health outcomes. Advancing transparent and evidence-based approaches. This again tying into the collection of race-based data, and then help using the data that we are able to collect better, or identify where the gaps are, so that we can have more evidence-driven programs and policies, and help to develop the basic investment cases and have measurable goals and outcomes that can be tracked and reported and can show what's happening in Black communities. Next slide. Public education, there's a lot of work that we need to do to center in Blackness. you know, that's this is I think of myself here and how much work you have to do when you come to work to show up as yourself sometimes, and how much and how difficult that can be. And I can just think, and we're trying to do a sector-wide change in our Alliance family to really affirm Blackness, and to really, and that can, I imagine this will be, you know, this will have a lot of discomfort. But if we are to really meaningfully talk about moving the needle on Black health in a positive way, then this is very important. And then, of course, within that, we have to look at the distinctness of the Black experience and the intersectionality of Black population. We're not a homogeneous group of people, because many people don't understand that. But, and those things need to be fully considered. And also, we need to educate, fair but educated here to help us, help our Alliance family to better understand, you know, Blackness and what it is, and what anti-Black racism is, and what we, so that we can, you know, better meet the needs of our of Black populations. It's really just, it sounds simple, but it's a huge undertaking here, because we are coming up against, you know, hearts and minds that have not been, some can see some of this as a new thing. And why Blackness? and why now, kind of thing. And it's not for us to make the case, you know, like, if that's the kind of conversation that we're going to be having, then you know, we're at a different place. But it's important that that needs to, that is carried forward. And this plan recognizes that it is important to do that kind of work, to get people to understand what Black health means, what it means to advance Black health is to understand Black people better, so that we can make better programs, better policies to meet their needs. Next slide. I think I have just a couple more, or one or two more. Yeah, so regarding sustainability and partnerships, you know, the Alliance itself is a partnership. It's the Alliance. So the Black Health Committee, as a committee of the Alliance, will seek to partner with, across the spectrum, with internally, externally. You're going to be hearing from some of our key partners just after this. And that's important, because that will help us to sustain the work that we're doing. We are one part of a system, a very important part. We are, but we belong in a system, of course, and we will be seeking to bring those, you know, those elements of the systems in to help sustain what we do, of course. And then there's sustainability, and this is a bit more focused on the committee itself. Noting that, you know, this is not the kind of work that that will just, you know, it dies without, or it ends when people leave. So the committee is committed, and as Sarah said, Alliance is a learning organization, to set the right foundation for long-term work in this area. And that also means, you know, long-term engagement with the government and with different the different partners to continue to elevate Black population health issues, and also to really address anti-Black racism and its many manifestations. So this strategy really is us working together. And it's, you know, we know how to work together, obviously, but it's a new partnership. We have something. We have a roadmap. We have you know, signposts. We have targets. We have strategies. We have enablers. We have things that we are setting out to do, and the success of this strategy really is it really is based on our ability to continue to work together. I hope from this presentation that you will feel inspired. I'm certainly inspired and looking forward to be working with you. I also want to give a big shout out to my director, Marie-Lauren, to the committee, and also to Sarah for their leadership and their continued support for moving the Alliance in this direction. This is a time of some celebration for where we are, but it's also a time to do deep stock taking for the journey that we have ahead. Thank you so much. I'll pass back over to Francis.
Daniel, thank you very much. I know that was quite a mouthful of document to present. And this is where when we have those moments of being in person, we were hoping when we were in phase wave 3 of COVID that we could do this event in person, where we could be walking around with our plate of fruits and all those little sweet tests that will tickle our tongues to make sure that we can even inject as much fuel as possible into this. But the good thing about life is it teaches us to be adaptable, and we are one social animals that know how to do that best. And the current situation has taught us even much better to be there and to do exactly that. So, I just want to flag that I think time-wise, we are doing a little bit good. So I'm going to be bringing in the next speakers who we have brought to this event, because of the work and the partnership that they've always done and have with the work that's, before us. And this group of speakers that I'm bringing in, I want you to link back to the conversation that Daniel has just shared with us, which means this work is not for the Alliance alone. If we were going to just saying, this is our work alone, I think we will be making a big mistake. So these folks that I will introduce in short order, and I'll bring them one at a time, they will actually present one of the strongest levers for why the work that we do at community level produces such immense speed and such immense uptake, the adoption of what that work is. So next in line that I'll bring to share with us some experience is a dear friend and a colleague that I've worked with in Durham for over at least now close to about 2.5 years. And it's an individual who not only speaks the language of inequities and disparities, mostly to vulnerable population, not only talking at Black, but even the layers that are underneath the population segment that we are talking about. It's also the vulnerable youth and folks that are living in the community with these disparities, that we already know. So Ms. Nicole Perryman is the Executive Director of Infrada, but also a co-founder of Kujenga Family Cycle. We have done some wonderful work with Ms. Kujenga within the Durham region, where she has been ahead of her time in terms of advocacy and the challenges that we continue to face today. So without further ado, I want to invite Nicole Perryman on the podium to share with us some of the wonderful information that we can take away as packages of good nuggets. Nicole?
Thank you. Oh, I can hear myself. I'd like to thank the Alliance for Healthier Communities, the Black Health Alliance, the Black Health Community Changemakers, executive directors of the health centers across the province for inviting me to speak at this launch today. I am so grateful to all of the attendees for the opportunity to speak and to really share my experiences and ignite some of this much needed work for the Black community. A Black health strategy is part of that continuing journey for social justice and equity for Black people in Canada, in Ontario itself. The launch today speaks to the tireless hours dedicated to addressing the disparities for Black people in health. A part of Afrocentrism and Africentrism is centering on knowledge, but also the experiences of Black and people of African ancestry. And so I wanted to start with sharing my experiences with you all today. My parents had immigrated to Canada with very little informal supports, but they quickly connected with pockets of Black people in the community in which they live, and they are referred to as my adopted family. And this connection is what formed the Black community members connecting with each other to form a village. It was called the village, to support each other and their children. It was in this same community that I came to really understand mobilization occurring and spearheading movements addressing inequities that Black people encountered. And I'm talking about the 70s, the 80s, and the 90s. They also highlighted the accomplishments of Black people who were engaged in social action. They started organizations such as Harambee, Child and Family Services, Caribbean and Afrocentric cultural associations, and even women's shelters. And this is all here in Durham region, where I live. They supported their community informally to address the impacts of anti-Black racism, which was coined by Dr. Akua Benjamin in 2003. Anti-Black racism is a unique type of racism that targets Black people by stereotypes, attitudes, beliefs, practices, and policies, which are embedded into institutions. I remember our Sunday dinners with the community, and the adults discussed their experiences of racism within the workplaces, in schools, in health institutions, with the police, and within the justice system. I uniquely remember, horrific health stories and the grief and sadness and helplessness that often accompanied a lot of those stories. But every member of the Black community and those who hold African ancestry, we know these stories way too well. We know these stories, and it's time for us to move forward and strategize around building healthier communities. It was with this same generational experiences, mentoring and guidance, which led colleagues and myself to develop organizations that address the needs of the Black community. Many of these organizations use their own funds, our own resources. We depend on volunteers, and we're responsive to the community needs. As we learned 2 years ago from a publication from the Network for the Advancement of Black Communities, Black organizations are funded less than 1% of available for their initiatives, which means that anti-Black racism continues and our communities are limited in the amount of supports that we can provide and the impact as well. The pandemic absolutely highlighted the inequities prevalent in Black outcomes. It's not new. It's the opportunity to use, it's not even the opportunity to use the language, because we know this. This is what we've been talking about in our community for years. And even in my own family, and many of you can also say that, the pandemic has led to higher rates of death amongst our community, an increase in intimate partner violence and family breakdowns, addictions and opioid-related deaths, delays in accessing healthcare, housing crises, which are unique to Black families, and an overwhelming stress and mental health toll that it's had on the lives of Black people and their families. So it is critical for community health centers to have specific strategies that address these unique issues. And it's not enough for us to focus just on prevention and intervention. We also have to focus on that system level that begins to address the policies and practices that reinforce anti-Black racism and the narratives told implicitly and explicitly about Black people. So in my community, we started developing a community organization, which started in 2020, and I called it Kajenga. Kajenga means to build in Swahili. We aim to build resiliency within our communities, our families, our parents, our caregivers, our guardians. And we spent the first few weeks just doing Zoom invites and Zoom meetings just to understand the community needs. And honestly, it was remarkable. We reached hundreds of people in a matter of 6 weeks. Our mothers, our sisters, our women, they spoke about racism in healthcare, discrimination, family pressures. Our parents, our fathers, our men, our brothers, they spoke about addressing stigma in Black male health, family and social wellness, and how it impacts them throughout their entire lifestyle. So starting from like birth all the way to death. Our LGBTQ youth, they highlighted the need for cultural safety to connect around their shared stories of addressing stigma, hate, discrimination, which often occurs in the community, but also in their families. And my favorite, we heard from our young people, Our young people who talked about their anxieties and their worries about the future and the need for representation in all areas of healthcare. Our innovative way to reach our community is grassroots and is responsive to addressing the need. We have the knowledge and the expertise to support our community, and we should always have the opportunity to take leadership to guide interventions and prevention efforts. In less than 3 years, as I said, we're in year two. Kajenga has offered over 50 events in reaching over thousands of people and connecting people across the world. Last summer, we worked with 10 grassroots organizations in Durham region alone to discuss and highlight the work in our community. We are addressing inequity and social determinants of health. We've always accepted and encouraged partnerships and funded organizations who create space, but not necessarily to replicate our programs into their programs, but to develop partnerships to strengthen the Black-led and Black-owned organizations to specifically support their ability to care for the community in which it serves, and which our community also feels most comfortable in being able to engage with. These services are culturally informed, they're relevant, trauma-focused, and holistic in approach. And we are the organizations who understand and can unpack intersectionality, anti-Black racism, intergenerational trauma, and the need for collaboration with health to address joint strategies to provide greater impact. And finally, the Black Health Launch Guiding Principles really speak to those community actions. So I call on you all to take that step, to be part of the change and to be part of the future. All these pieces bring together all the guiding principles, the results, will really help to build this call of action and the community partnerships that we need. My auntie used to call it, it is our responsibility and our sacred contract. And then we follow the steps of our ancestors who are no longer with us, who had this dream so many years ago in the 70s, to see it happen today. We gather the wisdom of our elders, we harmonize our stories, we bring those stories together and our research to build a platform of change. And we mobilize the energy of our young people. They're so amazing and they have so much promise to bring a better and equitable future for their children and our future generations. Thank you so much for having me.
Nicole, actually, thank you for the powerful delivery and also the connection to where we are today and where we've been and where we seek to be tomorrow. Quite powerful words. If there's anything at all we are taking from here, you made very compelling statements from systemic challenges to where we need to be as an individual grassroots organization and also as communities to make that work happen. And there is no shortage of passion in your voice, in your message, and it's something that we need to take from this moment carrying us forward to what this work is going to be. Thank you very much. So as I bring the next speaker, who you, most of you probably know very well, is a great friend and a great colleague that I've gotten to work with for the last 5 years. And the work that they do within their agency and their organization across the province is the work that creates the fundamental roots of where we are today. And some of the learnings and opportunities that will inform us to how we meet most of the pieces that you heard from Daniel earlier on, when we talk about the acronym CAP, which is that coalescing, the advocacy, and the promotion. You know, this is the message that you'll probably even hear more at a much larger level, you know, than what, you know, most of us, you know, are used to. So I'm bringing to the podium at the moment, Mr. Paul Bailey, who is the Executive Director for Black Health Alliance on the podium. Please, Paul, join us and share your message, and welcome.
Thank you, Francis, and good afternoon, everybody. Really, really appreciate the opportunity to hopefully share some quick thoughts. As I thought about what I would say, you know, I was thinking a bit about the moment that we're in, kind of where we still need to go, and, you know, all that's going to be required to do that. You know, I was just doing a lot of reflecting, thinking about, you know, how we acknowledge our collective struggle, the achievements, and, you know, really what a moment this is, and a moment to commemorate the launch of the Black Health Strategy here. as a significant moment for the work that we're all doing to, work around dismantling anti-Black racism and other intersecting forms of oppression. After this moment of reflection, I quickly reminded myself that it's also an opportunity or a moment to rededicate ourselves to the forward-moving and radical tradition that has brought us through both COVID-19 and much of the work that the last speaker just spoke to, Nicole. This radical tradition is something that I think the community health center is grounded in, and the radical tradition is something that Black communities, I think, especially bring to this work. We know that Black communities across the province experience a disproportionate burden of challenges across several social determinants of health, things like housing, food and income security, and access to the resources and opportunities that we know secure positive development in early childhood. We know that these inequities are further compounded by significant inequities as it relates to chronic illness, maternal, mental health, and addictions. And we know that at root of many of these things is not race. It's really a conversation about anti-Black racism and the barriers to care and opportunities that it creates. And when you take all these things together, for me, and I hopefully
And it sounds like Paul is frozen. I hope it's not on my end. And Paul, if you can hear me, you are laterally doing it in style. We are missing you now, and I hope you can refresh your system to come back. Okay. So welcome to the world of technology, and this is what we are all accustomed to. So we will give him a little bit of a window to see if he can bounce back. I know Erka back there, he's probably trying to get some connections and see if he can bring Paul back here. So while Paul is working on that, if most of you are like me, you have had so many conversations from the beginning of the top hour with Liben, Sarah, Daniel, Nicole. If you have any questions that you have right now, make sure that you are putting them down and sending them in the chat. Our wonderful team there with our Director for Communication, MDG, she's back there putting it down, and we will be sharing some of those questions back when we get to the question and answer. But we just don't want you to lose an opportunity to capture that. Just put it down, and we can jump on them in a few moments to come. Any word from Paul back there?
There's no word from Paul.
No word from Paul. We might have lost him. I think we can move on to Tanai and Anna.
I'm sorry.
Yeah. So that at least he's gonna probably catch us along the way, and we'll give him an opportunity to wrap up on the conversation. I want to take an opportunity to also highlight one of our key crucial partner within the space that we are doing the work. And that partner is the Black Physician Association, ED. As you are aware, the Black Health Physicians of Ontario are in the work right now of building their strategy. So I'll be bringing that speaker in a moment's time. I see Paul is back. Paul, I want to bring you back so you can share your thoughts.
My apologies, everybody. I don't know where I dropped off, but I'll quickly highlight 3 calls to action that I think are important to this work. So the 3 calls to action that I wanted to share were 1, starting where we're at, 2, continuing to harness the power of collective action, and 3, focus on driving results. And so I think, as many as shared before, for many, COVID-19 has eliminated many of the systemic inequities that a lot of us already knew that Black communities face. But personally, I saw the power of how folks came together and advocated to build a more equitable response to the COVID-19 across the province. We know that the crisis is not over and that there's more work to do to keep our community safe, to alleviate not only the pandemic burdens, but the long-standing socioeconomic, systemic, and geographic inequities that pose the greatest risk to our health. I think it's powerful to see the strong focus on community health centers throughout the strategy. And I think this focus demonstrates the key roles that CHCs have in improving the health and well-being of Black communities. You know, we all know that in some parts of the province, community health centers are the backbone and are at the forefront of responding to the health and well-being needs of some of the most vulnerable Black communities. I'm thinking of, you know, centers like Taibu, centers like Women's Health and Women's Hands. And I think as we work to implement, I hope that all member centers see themselves as a starting point for this implementation and, you know, part of the movement that is being reinvigorated to improve the health and well-being of Black communities. Number two, harnessing the power of collective action. Again, for me personally, I've seen how folks have come together for collective action to raise ambitions and focus on impact and the tactics to get there. Whether it's the advocacy or the mobilization across organizations, the organizations that have put this strategy forward, the people that have put this strategy forward, for me, represent you know, some of the best in the province. And I think it's going to be important that we continue to work across agencies, across jurisdictions to prioritize this work. And finally, focusing on driving results. So Black Health Alliance was formed over 20 years ago as a response to the situation that many of us are talking about. And we exist to listen closely to what communities identify as challenges and barriers to their health and well-being. And we work with communities to develop a vision for change and mobilize the tools, skills, resources, and advocacy necessary to improve the situation and ultimately ensure that Black children, youth, and their families thrive. Over the last number of years, we've seen and we've been focused on, you know, increasingly focused on driving results, because to be frank, for us, a program here or an emergence initiative there isn't good enough. If we know as a sector that generational poverty affects 50,000 Black families, our job as a sector needs to be to build a response that meets that need of that 50,000. While most Black folks are rooted in urban centers, we can't forget the growing communities in the north, places like Sudbury, North Bay, and Thunder Bay, and driving results there as well. And I think as we continue to drive work to things like the ongoing and worsening opioid crisis, we need to make sure that we're not leaving Black communities behind. I think each one of us has a responsibility to drive results. There's work being done by the Black Health Committee, which has brought us here together, work happening on Ontario Health, many folks across communities that are doing things that we don't even know about yet. But make no mistake that we're going to have to continue to push to protect our health and well-being. We're going to have to continue to advocate and get the focused interventions that we know our communities need. We at the Black Health Alliance are committed to driving results for and with Black communities and working with the Black Health Committee to do so. And so as we rededicate ourselves to this forward-moving work and the radical tradition that, again, has brought us through, I invite everybody here to join us and support this movement as we work to drive results for Black communities. So again, sorry for the interruption, and thank you, and good day.
Mr. Paul Bailey, no need to apologize. It is the real normal that we deal with. And thank you very much for doing everything you can on your end to keep this going. With that in mind, I think I had started introducing Black Physicians Association's ED, she's going to be jumping on the podium to share with us a whole lot of other things that are happening with BPAO. With that in mind, I want to bring Ms. Chenai Kadungure, who is the newly appointed Executive Director for the Black Physicians Association of Ontario, to come and give us some quick remarks and some of the synergies that we've been driving together to make sure that we can have an envisioned future that deliver to the core of what we're here to do. Ms. Chenai, welcome.
Afternoon, everybody. Yeah, it's very rare that people say my name right before the session, so it's quite nice to hear. As Francis has said, my name is Chenai, and I will be brief because it's brief remarks. I have 7 thoughts that I'm going to share, but I also want to stress that COVID did not create disparities, but only exacerbated them. I think there was a lot that was spoken about during the pandemic, where people kind of made it seem like, what's happening? And it's like, no, we know these disparities have always been there across all lines, in all systems. And we know the role of systems is not only to reinforce themselves, but without that, there's a strong intentionality with reinforcing the systems. And so we have to bring that same energy with breaking those systems down. And while the earlier speakers were talking, I even thought of that feeling of dread in the presence of people who should heal you, and I think those are one of the, what I would call the Black pain around health, right? That you're going to a space where there should be people who are helping you build or doing something else, but that's where you find the opposite effect. And so this is what drives me in this work, saying we do not want people to ever have that feeling. And I am so appreciative of all the CHCs because of that, knowing that people walk into those doors, knowing that they're going to get culturally appropriate care. And so we should not underestimate the strong role CHCs have played in this. For us, what has BPAO been doing? Over the pandemic, we were involved with a lot of position statements when there were things that would come out and we felt there needed to be an accountability or there needed to be a voice, some kind of advocacy. We always rally around that. We will put out a position statement. We will talk about where there's an implementing issue, and we believe in influencing where the power is, right? Speaking to people who can actually make a difference. And so that has only been possible through partnership. We literally have partners like you who come and say, there's this thing going on. Can you guys say something about that? So for me, that's very exciting. Of course, BHVI, the Black Health Vaccine Initiative, is a huge representative of the power of partnership, because through that and working with all of you, we were able to administer 60,000 doses that went to community that might have never happened without us getting together and saying, the way it's being done right now, it's not great, but we can do it the way we want to. And so I feel that is a big part of it, that we have to continue this level of partnership. And I'm going to talk a little bit later about some of that. And just to say, some of the strategies include things like barbershops, and it just shows you that you cannot look at Black health without having that Black health strategy and thinking about what are the cultural realities in this space, right? So when we're talking health equity, you can't have that without that intentionality of what is necessary for the community. And so that's why I feel it's so important that our, this collective we have here is the one that's involved with the work. And of course, some of the work we've also been doing is funding promising work. So where there have been community initiatives, clinics, and things like that, we have been able to fund some of that work using, some of the supports that we've received over the pandemic. George Floyd made a difference for everyone. There are literally organizations here that only started existing after that. So for me, my only concern with that is that has been the start of a movement, but we need to push that the movement doesn't just become a moment. As priorities shift, as we start talking about, okay, the Ukrainian refugees coming into town, there might be a shift in focus, but we have to make sure that we maintain the sort of prioritization that's been happening here, and that can only happen with tables like this discussing. One of the other projects we've launched is the Network for the Advancement of Black Medical Learners. If we want to literally change the face of medicine, there is only 2.8% of physicians that are Black in Canada. We want that stat to go up, right? So this project, the Network for the Advancement of Black Medical Learners, is getting six of Ontario's medical schools involved and committing to shifting curriculum, to giving mentorship, to having stronger learner-to-physician pipelines, looking at wellness, right? Physician wellness early on before people are even physicians, because there's a lot that happens in those residency programs that contributes to that stat, that 2.7%. So for us, we're also saying, looking at the future, we also want to change the face of medicine in this way. And as I said, culturally appropriate care more than matters. We have to just keep harping on that until it becomes a reality and we don't have to push for it every time. So there's a lot of transformation that needs to happen, a lot of different mental models that we're pushing, and we cannot do this alone. It has to be through a collective. And that's why partnership with a capital P is what we're doing here. I don't know if they've talked about, we're now having an MOU to actually put to paper this is what our contribution is going to be to this exercise long term. Because I think even keeping ourselves accountable to the work that we do, because it's easy to get burnt out and just say, oh, this problem is too big and disappearing. So for me, that's just the encouragement I thought was necessary for us to have today. And finally, also, obviously, a thank you that you are all the heroes and sheroes that have made it possible. You know, we could have waited to be rescued, but I so appreciate the energy of everyone here that you said, you stepped up. And us as BPAO, we will always be there. We're always going to support. And, you know, we've had, like we said, good relationships with funders who are willing to push our work for the next couple of years. And you've all been a pivotal part of our strategic planning process. So cheers to the next 5 years, and I can't wait to work with you all.
Wow, thank you very much, Ms. Kadungure. Those are really encouraging words. And I've once heard the comments, if you want to get things done, talk to Alliance members. You know, I don't mean to brag, but this is the place where I'll just mention that. I've heard that before, and I wasn't the contributor to those words. Obviously, there are other members out there that you know, would resonate with that. And you mentioned quite a great point in terms of the area in which you're investing in making sure that there is more Black physicians right across the spectrum to make sure that, you know, some of these inequities, what we are talking about, we do have both sides of the coin being met. Yes, we do understand that we exist in this human capital space, the giver of care and the receiver of care being able to be complemented, you know, to make sure that those words that came from the result area of our strategy, as we had Daniel talk about earlier, in terms of the mobilization, the centering on Blackness, the distinctiveness, all those need to be good places and confluence of which way this energy comes together to be able to bring that light to the service that we are trying to build. And thank you very much for that. So I want to bring our last speaker for the day, a colleague who I've worked with for a number of time on a number of life-changing initiatives, and a leader within the system that I know most of you are waiting to hear from in terms of the confluence of the work that we are doing at the Black Health Committee as a committee of the Alliance, but also the work that's happening provincially, led through the Office of you know, Ontario Health. So to come on the podium is Ms. Anna Greensbeck, the Chief Regional Officer for Toronto and East, and also the Executive Lead for Equity, Inclusion, Diversity, and Anti-Racism under the Office of Ontario Health. Please come on the podium and welcome Anna Greensbeck.
Thank you so much, Francis, and thank you to the Alliance for inviting me here. I'm here with my colleague, Corey Bernard, who many of you know, our Director of Equity, Diversity, Inclusion, and Anti-Racism at Ontario Health. And it's just a pleasure to be here with so many partners who we've worked with over the past few years and before. And I also just want to say thank you to all of you for your tireless work in and throughout this pandemic, and always pushing our health system at every turn to a more equitable response, which I know is more of a struggle than we would like it to be. But I do want to acknowledge the pivotal role at many points in through each successive wave that each of you has played collectively in making a difference and saving lives. I'm really, really pleased to be here on this momentous occasion. I think it's incredibly timely to have the significant accomplishment of a Black health strategy. I think, as Francis described, it's so important for us to get this right. And I think of that in terms of the fact that we have many years ahead of us in order to recover from this pandemic. All parts of society, every health system, every society in the world is thinking about this. And we cannot give up on the idea that equity is essential and critical to recovery. And that's what you have described in your strategy. And I think that makes it incredibly timely for us to be advancing this work together. We share, as Ontario Health and all of you, a #1 priority in terms of reducing health inequities. We at Ontario Health, through our Equity, Inclusion, Diversity, and Anti-Racism framework, have explicitly called out that addressing anti-Black racism and anti-Indigenous racism is fundamental. It is It's the absolute beginning of how we're going to address discrimination in all its forms, and to acknowledge the fact that this is directly tied to health experiences and health outcomes, and so that we don't have a choice but to address racism. And I'm really proud to be able to say that we had the opportunity to convene and facilitate the Provincial Black Health Plan Summit and Working Group. And it was a privilege to have organizations such as yourselves and other partners call upon us for our support and our ability to come forward at a timely moment to provide that and to work alongside all of you to advance our shared priorities and our mandate, and importantly, to have the leadership of Graham McKenzie and Angela Robertson in leading that work. We're proud to have worked together with all of you through that, in addition to turning our attention weekly, daily, hourly to response, to be thinking ahead to developing a provincial Black health plan, to say that Black health was something that, as Shania said, is not a moment. It is a movement. It has to be part of our recovery and our response, and to be sustainable. And as part of that, we have embedded this Black health plan into our own annual business plan, and setting ourselves up to set expectations of the system to help us deliver on this plan and deliver on this commitment. The Black Health Plan relies, as does the Black Health Strategy, on the sustained and specific commitments of partners. And I think of the Black Health Strategy as exactly that. Nicole talked about the sacred contract that's needed to advance this plan. And I think that those pledges, those commitments, and the articulation that you've put on paper is a really shiny example of how we can deliver on Black health and the shared outcomes that we'd like to see. We are only going to be stronger together. I also just want to call out my gratitude to the leadership of the CHCs, the Black Health Alliance, the Black Physicians Association of Ontario, in your significant role in equitable response. I know that your work has been an inspiration for the Black Health Strategy, for our provincial Black Health Plan, in showing us what's possible and why we can't just say that this was time limited and now we'll move on to the way it was. That this has to be all of the lessons that you highlighted even more in the pandemic. I know these were not invented in the pandemic. You came into the pandemic with this way of working with communities, but allowing us to not ignore this as we move forward to recovery. And I think about examples like the Afrocentric Black screening program that Taibu mounted prior to the pandemic, showing what was possible in terms of a sustained commitment to centering Blackness in cancer screening and in Black health, and how over many years you can see significant and sustained improvement. It is not just something that we will remember as vaccination. It's something that we can do in chronic disease, and I think that's incredibly important. But it is incredibly important to think about the collective action that all of you were part of in terms of vaccination. It is a tremendous feat that Black communities that we know would have been left behind without your advocacy first, and then your intervention, your collective action, and calling upon all of us to bring our support and infrastructure and our ability to help convene that and sustain that and give profile to that was a privilege. So I will just say, I'll close in saying that I look forward to more inspiration that I know is to come through this Black Health Strategy and your partnership as we advance that work together. And I think the incredible alignment of the Black Health Strategy and the Black Health Plan is an opportunity for all of us. Thank you.
Thank you very much, Anna, for those confirming words and support of the work that is here. And definitely the confluence of what's happening with the Black Health Plan, the provincial plan, and this work under the Alliance umbrella is pretty much, you know, a nice little place, a platform in which I think we can see this work being able to be sustained, and we are able to make sure that all the learnings that we're all gathering at this moment together in this path we can use those as opportunity for quality improvement in where this work goes for not only tomorrow, but for decades to come, to make this a permanent offering in the way how the system sees itself. And I often hear in most of the conversations that I sit in, that the current way and the responses that our healthcare system is laterally can be renamed as a sick system, not a healthcare system, in the sense that we have people gravitate towards getting supported at the moment in most of the times, the lowest moment in their life. How do we make sure that the investment in the upstream world in which we prevent, protect, becomes the way of delivering care? We know some countries that we are reading about, Singapore, Finland, those that have been off the gate from the get-go. These are the kind of directions that they've taken, decades and many moons ago, to make sure that they bring communities to the forefront of the conversations to design that which is pivotal to sustaining them and actually creating a healthcare system that allows them to live a life, as we intend it to be. Healthcare happens at home. Healthcare doesn't happen when you intersect with the provider. So this is the culture that you are hearing the Alliance coming from. And that voice definitely, Anna, cements the direction in which we are going. And I know now we promised you that we are going to be taking questions and making sure that we have an opportunity here to have our guest speakers answer. I know Corey, I haven't brought you on the podium to say hello, and Anna has introduced you there. So I know there are questions that are going to come. So I wonder, before we get there, Marie-Lauren, you're going to hold that space. If you have questions that have been coming, you can share them so that at least we can get them addressed. But before I get there, Corey, I wanted to get an opportunity for you to say hello. And I know you have lots on your table across the province, supporting and working with Anna in this work. But this is home to you. I don't think you'll find it surprising that we all know you and we have all done work with you, and we continue to bug you even in the middle of your lunch to ask for questions. So please jump in to say hello and share some remarks.
Hello, and thank you. I'm Corey Bernard. My pronouns are he, him. As you heard, I have the pleasure of working with Anna at Ontario Health and many folks on this call as well. I don't want to take too much time, just to say that I appreciate it. First of all, Francis, never a bother. Feel free to reach out. Black folks need service and healthcare over lunch, over dinner, at night. So feel free to call out at any time. But I'm happy to just lend time to the folks for questions, and I'm here to answer with Anna alongside if need to be.
It's always a pleasure. So on the questions, so this is where I open it up to our comms team there. Any questions that you want to share? And if you direct it to somebody, just let them know right away and they can help to jump on it as quickly as they can.
Awesome. Thank you so much, Francis. We did have a question in the chat that's directed to all of the speakers. So I got the question. We got the question from Jen Quinlan, and appreciate that so much, Jen. And I know that you'll connect with Daniel as well, but I thought it'd be helpful to share with the whole group the question, and perhaps if any of our speakers have any recommendations or suggestions, that would be helpful. So there was a question about if there was a structure to connect with in order to implement the strategy locally, or if we're going to be, pulling together something for ourselves. And so I'm looking at it based on what we've talked about and the Black Health strategy that we've shared, if there was a recommendation from any of the speakers regarding what's one thing to get started, what's one thing if you need to get started that you should be doing, or if you're continuing on your journey, what is something that you could be doing. So the question really from Jen, we should probably stick to that, is looking at local versus regional or provincial level. And I know that we've got Ontario Health on the line, as well as Black Alliance, as well as BPAO, and we had Nicole as well from a local perspective. So opening the floor, if you wanted to share some thoughts on how you could advise people to implement the strategy locally if they were gonna get started. And maybe I'll call on Anna. I was thinking maybe to call on you
Yeah,
first.
I'm happy to speak up. I do think the Black Health Strategy planners may want to speak to this, but I will just offer that we foresee continuing the Provincial Black Health Plan Working Group, and that will certainly be a point of intersection for all of the commitments and deliverables, and frankly looking at data as we go ahead to see where to put our efforts. So I would certainly offer that venue.
Awesome, thank you so much. Francis, I see your
Yes, so just adding on those same comments, you know, there's a lot of work that's gonna happen here, and thanks Jen Quinlan for your question. What I want you to, and everybody on the call to remember, is this is going to be a systems work. As much as we are announcing today on this platform for the Alliance, think about you know, the power and the connectedness that you have in your communities and the work that you have always done. This is going to be you asked the question, are we going to be expected to be doing some of this on our own to design something? There is going to be an element of that because it's not going to be one size fits all. But I think what we see as things roll up through the system is the intersections between the work that's happening on the OHTs, in terms of that work that's happening on the OHT in terms of equity is one of the pillars that each OHT is required to report on, and also to have a very distinct strategy on how to meet the needs of all the population segments that are in there. Black health is one of them that I think you know, is going to be sitting on each one of the OHTs to make sure that they have a local solution to what that work is. So when you think about that as three-legged stools. Here's the provincial work that's happening with the OHTs. Here's what's happening with you within the Alliance. But also don't forget, our power resides in the community to those whom we are here to serve, so that at least none of those three legs of the stool should feel shorter than the other. And that challenge is to you, and to make sure that any recommendations you have, send them along. And our job is to listen. We don't own this, you know, as individuals. We collectively have that, you know, force to make sure that we get it done together.
awesome. Thank you so much, Francis. That was really helpful in terms of framing it. So thank you so much. And I see the comment from Jen. That's perfect. I wonder if Daniel, if you could as well answer some of that, if you could maybe weigh in on your thoughts.
Absolutely. So I think this is a strategy also for the Alliance. So there's specific things that we're doing now in our implementation, and we'll be doing yearly implementation and planning for each year. For the first year, a big process of the big focus will be to document what we know is existing already, and we have, and also so we'll be doing a fair bit of documentation, trying to get a sense of where people are. We have some plans that need still to be that will go through the Black Health Committee as well, about things that for a specific action that we like centers, member centers to take. We'll also be doing a fair bit of further socialization of this work and trying to get a sense of where you are in this journey. And that's the focus of the first year. There are quite a bunch of other things happening at the provincial level. So we're also trying to get ourselves properly situated to be to lead on whenever those things come to fruition, that we're able to work on them. I've been a bit vague here, but it is because at this time, the big focus is to document what we're doing already. But also there's a discussion that's happening at the committee level about what else we need to do for the first year. I can tell you though, the big focus for me is to really move towards the collection of race-based data, looking at what we know we can do already within the Alliance. Within that, we have ideas about how to have better measures, or we look at our measures again to ensure that they're robust enough to give us the information that we need. And yeah, so that would be what I would say is our focus for the first year. But this is, you will be hearing from me, and please do reach out to me and set up a call or anything that you would like to do to further discuss or to hear if you want to know more, and also to get us to come to you as well to do some further work with you about what actions you can take.
Thanks so much, Daniel. I really appreciate that. And I know it's a little bit vague as we work it through it, but I think that it will take a lot of community engagement for us to get specific. And as Francis said, it won't be one size fits all. It will be tailored to the community that you're in. So, you know, we'll work together to develop that. I see a hand from Cheryl, but I also know that Paul had some thoughts as well. Should we get your question, Cheryl? Maybe Paul also has an answer for you on that. Go ahead, please.
It's not a question, but a comment, so I wait for Paul.
Okay.
Go ahead.
Thank you so much. Paul, I think you said you could share some thoughts on this as well.
I just have really quick thoughts. I actually think that this is the work. We're building on a legacy, but we are innovating the approaches, right? So there's a ton of work that's happening at the provincial level through Ontario Health, and work that we're doing on the ground to support that at the Black Health Alliance, and the work that's coming at through the Black Health Committee. But I think as folks start to pull together and we start to invite folks to the table, it's going to be important to not come empty-handed, so to speak. And so I think there are three things that member organizations can start to do so that as we bring folks together, we're having a conversation that's on the same page. I think it's going to be important, one, to start to understand the population, or the population of Black folks that are in your region or in your catchment. You know, so where are those folks? You know, are there large or small concentrations? Do we understand their needs, and what are the processes we can enable to do that? A partner goes a long way in building connection to community and helping you navigate some of those pieces there. I think centrally, we're doing a lot of work right now to think about like, what data do we need and what can we get? It's never going to be perfect right now, but I think this is another way that agencies, especially those that are already collecting socio-demographic data in their centers, can help to help build the understanding of what's happening kind of on the ground and bring that to the table. And then two, I think it's going to be important for folks to look for the like local networks of supports. Who are the stakeholders? Who are the networks? Who are the leaders in communities? And thinking through, how do we work and build good relationships with folks? And we know that, you know, none of this work happens, you know, in silos. It's not one organization doing things. So it's going to be important to do those things. I just thought I'd share those three things as folks start to pull together.
Thank you so much, Paul. And I think you hit on an important piece, because we're also looking at resourcing. How do we resource this work, right? Because I think you had said that very nicely. Thank you for raising that for sure. All right, Cheryl, shall we go to your comment, please?
Sure, thank you. I just wanted to say, and I really, Corey's comment really resonated with me in that Black people need help all the time. Based on what we just heard, let's not wait for a perfectly baked plan to do the work. We can all do the work. You know, the partnership, the networks, the willing individuals and groups are out there, as you just heard from a few, and let's just do it. And just grateful that it's actually, we're at this point and this juncture. The work needs to be done regardless of where we are in this province, and we're all here to help. It's a phone call away or a Zoom call away. Thanks, everybody.
Thank you, Cheryl. Thank you, Cheryl. That was lovely. And yeah, I just wanted to take off of what Paul had said as well about understanding your population. I think that, you know, we see it visual. I think Daniel began with that. Black people here, you see them in your community, but if you're on the call and you're a non-Black person, you might not know, depending on what community you're in, you might not know, you might not belong to that community or know what the interactions are. So I think it's very key for people to understand their community and not to suppose, oh, I'm in a northern community or I'm in a rural community, and there aren't any Black people here. Just because you don't see them doesn't mean they don't exist. So it's important for all of us to do that work and get the data that we need in order to do good work here. Wonderful. Thank you so much. So Francis, I actually supposed to have a couple more minutes to do Q&A, but I'm not seeing a lot of questions in the chat. And I only had one for those who are joining us on the line. So I wanted to see if we had a couple more minutes to ask the people who joined the line as participants and who've had a chance to hear from Francis and Daniel and Sarah and from our guests, Nicole and Paul.
Nicole, Paul et Anna aussi. Quel est le soutien que vous avez besoin pour pouvoir faire l'implémentation au sein de votre communauté?
Donc, I'd love to have conversation about that, but I do see a hand from Angela Robertson. Please go ahead.
Oh, thank you. So just again, congrats echoed for the launch of the strategy. And it's just a comment that for us collectively, as we do the work, as we have seen in this COVID moment and even prior, and in the post George Floyd murder, and the moment we're in as well, where we're seeing, I think, a bit of a receding tide in commitments to addressing anti-Black racism. And, you know, during that moment, we saw lots of public statements made by corporations, by organizations on their public-facing communication portals around commitment to addressing anti-Black racism. And I think in this plan and in this moment of an election coming up is, I think, a moment as well to ask for not just a commitment to addressing, but I think a reporting on actions taken and or actions planned in addressing these sites of injustices and inequality. So that's one piece. Just in the moment of the election, wouldn't want us to not be kind of keeping that in mind. And then the other comment that I would just offer is that the work is not easy work. And the work that is both designed in the strategy and the work that is both designed in the Ontario Health Black Health Plan is work that may make sometimes unpopular engagements disquiet. But if there isn't disquiet and disruption, then there isn't necessarily change. And so while we are in this happy family moment as an alliance, is that we may come up in some rubs with each other within the systems, within communities, and that is okay. So just wanting to center that in this work as well, is that there will be pockets of contention, and that is also a pocket where places of change happen. So just wanting to acknowledge that, so that when it comes, there isn't like things have gone awry. It's not about things going awry. It is in fact sometimes because things are in fact going well because disruption is taking place.
Well said, Angela. Thank you for that. I think that it's helpful to acknowledge and hold some space for some of that discomfort, because as you said, and I think it's been said before, this is not easy work, right? We're talking structures and systems. It's definitely not easy work. And I think it's a well said the point that you made, that we should hold space for that and be prepared to be, you know, we may be into that as well, right? Great comment in the chat. Yes, thank you so much for the comments so far. All right, thank you guys for chiming in. I was hoping to get to some more comments from people who attended in terms of what you'll need, but I know that Daniel has put his email out there. Feel free to reach out to him if you've got questions or concerns that you weren't able to share today on this call. Daniel's the Black Health Lead and will be stewarding this work along with the Black Health Committee. So I would encourage you to do that. I see a hand. Thank you so much. Nala, please share comments or questions. Thank you so much.
I think Mary-Lolaine Wangari was first. I'll go after her.
Okay, I didn't see that.
Yeah, so this is Wangari from Women's Health and Women's Hands, and I am not going to put on my my video for specific reasons that I will not share. I was typing in the chat, but you know I pressed the wrong key on the send before I finished the sentence I was going to make. Those of us who are doing this work already know it is heavily under-resourced. And we're at a point where we have a really great plan that you know you shared today. There's an election coming up, and I'm wondering how we can actually take advantage of this present time to actually start seeking for resources before the election is called, because then we lose that opportunity. If the government comes back, they have given so much money all over the place. How can we be one of the groups that is actually getting the money by taking advantage of this moment while the momentum is going and we have a really good plan? So what are the plans?
Great question, Wangari. Thank you so much for raising that. I'm sorry I didn't see your hand beforehand, but I think that's a great question in terms of government relations and seizing the moment as we're in. And I think it was also mentioned by another speaker. I don't want to answer that one myself at this time because I think we have a lot of excellent speakers presenting today. So I just wanted to open the floor and see if there was anyone else who wanted to jump in on that.
So I can maybe start by saying, you know, you really have a great point that you have made there, and exactly like what Daniel had said earlier. I think the moment now is thinking about, you know, how do we make sure that this plan is also positioned squarely within our alliance. Remember, this is the work that's being done by the Committee of the Alliance, and also the board of the alliance. As you see in the strategic plan, the board fully endorsed this work. So that part of you know, pushing this initiative forward to either via Treasury and also the politicians to know is part of the work that this committee has already been talking about, and Sarah definitely 100%, as you heard from the beginning, is thinking about how to help in resourcing some of this work through the avenues that we know definitely we need to poke in much serious ways, and to make sure that the message is out there to say, yes, you know, it's not shortage of the skill and the understanding of how to engage the communities, but does that as a resource, like those resources that need to come, you know, how can we make sure that they can be just in time to make sure that it's positioned well? So it's not lost on the committee, it's not lost on the alliance. That has been also factored in the conversation in terms of what are those next steps, what are they going to look like? So, and thank you for that question, Wangari.
Marie-Laurent, if I could just very briefly say that it is in all of our pre-election materials that we're, you know, sharing with the candidates that we're meeting, but also it's in the pre-election toolkit that all member centers will get, and so you can do, you know, use the speaking points and things to do for your own advocacy with your local folks. So definitely on our mind, Wangari, and actively trying to seek out resources where we can, for sure.
Thank you so much, Sarah and Francis. And I did see that there were two hands, Francis, but I'm aware of the time. I think Shola Alabi had raised her hand, as well as Nala. Do you think we have time for those questions?
We can take them. We have just a minute and so to do that.
Okay, perfect. If Shola Alabi is on the line, I think.
Hi, everybody. This is Shola Alabi, and thank you for putting this together. This is the first time I'm at such a forum, just because I just stepped into a new role as the Director for Diversity and Equity. And what my question is about centering, Black centering. I think it's very, very difficult to do. And so I was hoping to say something about that, but when Angela spoke, and Angela was talking about how difficult the work is, but that the persistence is what we need at this time. So that was why I put down my hand that I've had what I needed, and that I'll be reaching out to Daniel to ask for more questions as to where I need to take this work to. Thank you very much.
Thank you, Shola. Thank you so much. Appreciate that. Nala, did you still want to share your comments?
I guess I'm sort of the same with Shola, that it's been mentioned, but just briefly, when Liben was speaking earlier, I think for some of us, it's still very tender. We really stand on the shoulders of those that have come before us. And, for us, this road, it's long, it always will be, and it continues to be a difficult one. And but we take these moments and take them in stride, and we feel very humbled and encouraged. And we know it is tough. We know it is a long road. We know it's not a sprint, it's a marathon. And we look to the Alliance to continue to give us that support and that space. And we look forward to venues like these because they re-energize us and encourage us in moments when sometimes it's very difficult to be Black, to be in the skin, but we recognize that we have to continue on, and with a collective and amazing individuals like yourselves and amazing allies as people who took the time today to be here, and people out in the community as well. I just want to continue to encourage all of us in this work, and to just stay focused and not be diverted by the noise, because there's a lot of noise there, and I think that's what sometimes we lose the focus and lose the energy. But I want us to encourage that we are working in a space that is not necessarily designed for us, and not designed and by people like us. Therefore, it is the moment to make a good trouble and to make change. And I just want to encourage all of us to stay focused on that. Yeah.
Thank you, Nala. Thank you so much for that. Good trouble. And with that, I'll turn it over to Francis for the closing. Thank you so much, everybody.
And thank you very much for those words, Nala. I would not have wrapped the session in much eloquent ways. I appreciate those words of wisdom. And to all of us here is the